Good morning. Thank you, Dan. Each year, the Levy Lustig Student Fund recognizes students' outstanding original research in medical decision-making in order to attract the best and brightest minds to SMDM. Once again, we've had an outstanding set of submissions this year. And before the students begin, I'd like to take a moment just to recognize all of the mentors in the room who have trained and guided these students, the judges who graciously donated their time this morning very early to judge their posters at the moderated session, and everyone who's contributed to the Student Prize Fund. Take a moment just to say thank you. Thank you. Now it is my privilege to welcome to the stage this year the 2019 candidates. Each will be giving a brief elevator pitch talk, highlighting their work and introducing themselves to the society. Without further ado, Dr. V, please lead us off.
Good morning. Want to make sure this small aneurysm doesn't turn into a big headache? Join me, Clark Viet, at poster number 1 to differentiate between management strategies for brain aneurysms and learn how our cost-effectiveness analysis can guide shared decision-making for patients young and old. Thank you.
Good morning. My name is Praveen, and my poster is about the use of a whole genome sequencing method to detect hospital outbreaks, and we found it to be an extremely cost-effective strategy. I would like to invite you to visit my poster and know more about it. Thank you.
Hi, my name is Kung Ho Soo, and I'm currently at the University of Pittsburgh. The aim of my poster presentation was to assess whether current clinical practice with P2Y12 inhibitors is a cost-effective approach compared to clinical guidelines which advocate the use of ticagrelor or generic clopidogrel. Thank you.
Hi, I'm Douglas Chung. I'm a master's student and urology resident at the University of Toronto. For individuals at risk of prostate cancer, clinical evidence now supports the use of MRI and biomarker testing, so we built a 2D Markov model and found that an MRI-based strategy was cost-effective and dominated the traditional approach. Come visit us at 2-4. Thank you.
Hi, my name is Dr. Sadia Sadiq-Sada. I'm a PGY5 psychiatry resident at the University of Toronto. I recently graduated with a Science Master's in Health Policy at Harvard T.H. Chan School of Public Health. I recently published about my experience of being a sister to someone living with schizophrenia, published in the New England Journal of Medicine. Come find me at PS25 to learn why the analytic perspective matters for the cost effectiveness of early intervention in psychosis. Thank you.
I am Derek Kim from the University of Toronto. I'm a cardiac surgery resident. 2 recent clinical trials were published in the New England Journal of Medicine showing that transcatheter aortic valve replacement is non-inferior to surgery. However, the cost effectiveness of these 2 different devices differ, and we examined that in a cost effective analysis. So come visit poster 6.
Hi, my name is Gabrielle Jongeneel from Amsterdam University Medical Center. And in a model-based cost-effectiveness analysis, we conclude that the selection of stage 2 colon cancer patients for adjuvant chemotherapy can be improved by changing the strategy in a personalized manner. Are you interested how we came to this conclusion? Please visit poster 8.
Good morning, my name is Boishan Zhao from the Choice Institute, University of Washington. So we developed a US catalog of age and medical condition specific healthcare costs in order to inform the future cost calculation in cost effectiveness analysis. If you are interested in future cost, please join me at poster number 9. Thank you.
Hi, everybody. I'm Andrew, a PhD candidate at the University of Toronto. With the World Health Organization recently releasing their global strategy for the elimination of hepatitis by 2030, there is a need for innovative approaches to hepatitis C screening. So please come join me at poster 11 to see if the emergency department can serve as a setting-specific opportunity for HCV case finding. Thanks.
Hi, my name is Jamie Cohen, and I'm a PhD candidate at Harvard and also on the job market. For this project, I developed a novel model of HIV infection, type-specific HPV infection, and cervical cancer, and use this to evaluate when it would be optimal to differentiate cervical cancer screening by HPV vaccination status. Come to poster 14 to learn more.
Good morning. My name is Annika Claypool. I'm a PhD candidate at Stanford University. Dengvaxia, a dengue vaccine, may increase risks of symptoms in people without previous exposure, but can it be cost effective? Please visit my poster at poster 15 to discuss this further. Thank you.
Hi, I'm Nathan McClure. I'm a PhD candidate at the School of Public Health, University of Alberta. I want you to think about the meaning of small differences in health utility scores. Are you better, worse, or about the same? Come check out my poster, number 17, to learn why I think a difference needs to be large enough to be meaningful for patients.
Pregnancy is often described as a miracle, but it can also be incredibly dangerous. It may surprise you to learn that the leading cause of maternal death affects up to 10% of pregnancies in Canada and the US. If you want to know more about what women prioritize when they're faced with this decision, come visit me, Rebecca Metcalf, a PhD student at UBC, at poster 18.
Good morning. I'm Nora Crossno here. I'm based out of Johns Hopkins University. I've been honored to work with a robust international patient advocacy community to partner on a study validating the use of the EQ5D in a rare disease sample. So come talk to me at poster 19.
Hi, I'm Yasmin Saeed from the University of Toronto. Socioeconomically marginalized patients have difficulty accessing hospital-based clinics and thus may be omitted from many clinical studies. Does this result in biased utility estimates and thus biased results from cost-effectiveness studies? Our results suggest that yes, hepatitis C patients who have difficulty accessing hospital-based care do have lower health utilities. So please visit my poster to discuss.
Hi, I'm Anna DeRue, and I'm a general surgery resident at the University of Michigan. I'm interested in how patients make decisions and evaluate their decisions for the care of surgical diseases. Our study is patient decision appraisal in stage 3 colorectal cancer treatment. Come see more at poster 22. Thanks.
Hi, my name is Eva Alilay. I'm here to present a web-based patient decision aid for lung cancer patients, which will help them make a decision through different treatment options. If you are interested in my work, come and visit me at poster 23. Thank you.
Hi, my name is Bridget Hayes. I'm a second-year PhD student at Cornell University working with Dr. Valerie Reyna. The aim of my research was to understand how well single-item measures derived from fuzzy trace theory could predict the result of a 10-item measure. We found that a single measure of the benefits of drinking predicted the outcome of the 10-item measure of hazardous drinking with 74 to 80% accuracy. So to learn more, come visit me at poster 25.
Imagine having a loved one go in for an ultrasound, excited to find out if they're having a boy or a girl, and instead receive the devastating news that there's a life-threatening congenital heart defect. Now, parents must choose between termination, palliative care, or surgery. Come talk with me at my poster to learn how parents approach this seemingly impossible decision and how we can support them.
Aloha. My name is Gift from the University of Hawaii. Do you know that 45% of 6 million pregnancies in the United States are unplanned? We have developed a tool to understand the contraceptive decision-making process. So the result is super interesting. I can't wait to tell you more about it. So please come join me at poster 228. Thank you.
Hi, I'm Javad Nourzinia from Worcester Polytechnic Institute in Massachusetts. In collaboration with UMass Medical School, we use eye tracking to optimize the user experience of a decision aid for families with severe traumatic brain injury patients. To see our promising results, visit our poster 229. Thank you.
Feed the Future is a billion-dollar multi-country program aimed at reducing global undernutrition, which underlies over half of all deaths in children worldwide. My name is Tess Rickman, and I'm a PhD candidate at Stanford University. I find that Feed the Future has prevented over 2 million children from becoming stunted or chronically undernourished. Please come to poster 32 to learn more.
Hi, I'm Georgian Wu from USC. We constructed optimal screen policy for type 2 diabetes, considering age, BMI, and previous test history using a PONDP. This allows us to compare the timing and frequency of screening for different risk groups. The proposed policy is cost-saving. It saves around $4,000 per patient compared to the status quo policy. Please come visit me at poster 33. Thank you.
Hello, good morning. My name is Stephen Mack. I'm a PhD student at the University of Toronto, and this study uses health administrative data and laboratory data sets to estimate the health burden associated with Lyme disease, which is actually the most commonly reported vector-borne disease in North America. If you're interested, please visit poster 34. Thank you.
Hello, my name is Matt Carey. I'm a fourth-year medical student at the University of Michigan applying into internal medicine. Stop by poster 35 if you're interested in learning how 8 years of longitudinal survey data help us better understand the relationship between sepsis, functional disability, and quality of life.
Hello, I'm Jack Ching from Stanford University. My modeling study of mortality rates among veterans with OUD found that short-term treatment can yield mortality benefits despite elevated mortality risk during treatment transition, and also suggests that efforts to improve retention are needed to maximize health benefits. Please come by poster 36 to learn more.
Hello everyone, my name is Özlem Dalgıç. I'm a postdoctoral research fellow at Harvard Medical School. And we developed this tool called NAFLD Simulator. It illustrates the long-term outcomes of non-alcoholic fatty liver disease. We believe that it can greatly help patients, providers, and health policymakers. If you're interested, please visit us at poster 37.
Abusive head trauma is the leading cause of fatal traumatic brain injury in infants. 30% of infants with abusive head trauma are initially misdiagnosed. I'm Dr. Katie Norbosch, and I'll be discussing strategies to detect abusive head trauma and save infant lives at poster 38.
Morning, I'm Kale Worry. I'm a PhD candidate at the University of Minnesota. My poster presents a cost-effectiveness analysis of the drug ivacaftor for the treatment of cystic fibrosis. Ivacaftor is very effective, but it's also very expensive. If you have any uncertainty about which poster to view first, I suggest you make a decision to go to poster 240.
Using a structural equation modeling for a latent variable, we found a new way to relate weight and height. That's a better proxy to health than the body mass index. My name is Enrique Saldarriaga from the PhD in Health Economics at the University of Washington, and I'll have all the details of the study at poster 41.
Hi, I'm Alton Russell from Stanford Engineering. I model policies to protect blood donors and transfusion recipients, and come by poster 42 to learn how we're managing the risk of iron deficiency in repeat blood donors. by using machine learning to personalize how frequently donors can give blood.
Hi, my name is Gizem Nemutlu. I am a postdoctoral student at Harvard Medical School. If you want to learn how much money we should spend on additional research to answer whether routine HCC surveillance is cost effective, please see poster 43. Thank you.
Good morning. If you're planning on having a drink or two or more at tonight's social event, please consider stopping by PS 244 to discuss how high-risk drinking impacts mortality. My name is Joven Julien. I'm an operations researcher at Georgia Tech.
Hi, my name is Giovanni Malloy. I'm a third-year PhD student at Stanford University in engineering. I'll be talking about the Black Death or plague, one of the most devastating bacteria in human history, which most recently was responsible for over 200 deaths in Madagascar. And join me to answer the question, can we stop the next Black Death? Hello again. I'm calling on all infectious disease modelers to join me at my other poster, where we explore how different types of models can impact the estimated effectiveness of interventions. It's one poster, one question, one call you do not want to leave unanswered.
Hi, I'm Jinyi Zhu, a PhD student in health decision science at Harvard. What is the optimal approach to validate a simulation model that is developed based on individual level data sets? We compared 4 validation methods and found that the bootstrap method has the lowest bias and variance, which was expected, but we also found a surprising result we didn't expect. Come learn more at poster 47. Thank you.
Hello, I'm Mauricio. I'm a PhD student at Brown University. You might all know that cohort models require a fixed cycle length in the simulation. What you may not know is that when you're simulating events that occur at very different rates, you may introduce bias by choosing a fixed cycle length. We introduced some numerical methods that adaptively determine the cycle length of the simulation. Come by poster 48 to know more details.
Hi, I'm Zoe Tao from the University of Minnesota. I'm currently looking for a job. In this study, we explore whether additional information about sexual behavior might change your mind from telling your sex partners to get your partner drugged when you have STI infection. For more information, please stop by poster number 49.
I'm Xiao Zhang, PhD candidate from Simon Fraser University, Canada. Dynamic HIV models are complex and uncertain. How do we address model uncertainty while enhancing the credibility of model outcomes? My poster at 2-50 describes a systematic approach for the calibration and validation of a dynamic HIV transmission model for 6 US cities. Thank you.
Hello, my name is Q. I'm a PhD student from Stanford University. I'm also very eager to find a new job. What assumptions are we making when we use the cross-sectional data for our model calibration? How does it introduce the bias to our model calibration and also other model outcomes? My research addresses this question in the context of heavy drinking behavior in China. Please come and check out my results in number 52. Thank you.
We have a round of applause for all of the candidates. All right. So I'd like to invite everyone to please join them again back over across the way at the exhibit hall for the poster session where there will be coffee. As you've heard, we have quite a few people on the job market, as well as many international attendees and many first-time attendees. Please welcome them to the society. Thank you and have a great day.